Welcome to day 2 of the National Minority Quality Forum's 2017 Leadership Summit on Health Disparities and Spring Health Braintrust. I am Congresswoman Robin Kelly of Illinois, and I serve as the chair of the Congressional Black Caucus Health Braintrust. We had quite an amazing day of events yesterday, and today we'll have another round of critical conversations on the topic of health equity. I am honored to lend my voice to this discussion. Not too long ago, I was having a conversation with Dr. Puckrein, and he mentioned that he wanted this year's conference to be the one that focused on building sustainable communities, delivering quality health care. During that conversation, he told me that we have unfulfilled potential in the health equity crusade, and that we must pursue initiatives to achieve our vision of sustainable communities, to assure that every American is proactively and constructively included in the research, policies, and metrics that define 21st century healthcare. I couldn't agree more. In that vein, today the Congressional Black Caucus will lead a series of talks that center on the importance of minority participation in clinical research and the future of minority health in America. Our theme, Beyond Tuskegee, Rebuilding Trust and Overcoming Barriers to Clinical Trials in Communities of Color, is a must-have conversation. We are all familiar with the high-profile and often whispered about tragedies in the annals of America's health history. The name Tuskegee still brings a chill to many. This week, many Americans will learn a little about the story of Henrietta Lacks, whose immortal line of cells were stolen from her body without permission, but whose use has advanced the field of medical research in unimaginable ways. But her story is tragic nonetheless. Still, the best way to honor her legacy is to improve the lives of her progeny. I always say, if you're not at the table, you're on the menu. We know that we must be better represented in the field of medicine in order for our communities to be prioritized in a way that is impactful to us, in a way that reduces disparities. Clinical trials are an important horizon for us to be better represented in. Today, we'll host 3 panels. The first, Beyond Tuskegee, Medical Mistrust and Moral Obligation in the Black Community at 10 o'clock. Minority Health and Trump America at 11:15. A lunchtime town hall discussion on the state of minority health in America. And last, a presentation of HBO's The Immortal Life of Henrietta Lacks, with a conversation about the Lacks legacy led by Susan G. Komen. And that's all before what should be an amazing Leadership Awards dinner and 40 Under 40 Awards ceremony. I am very excited about today. But before we dive into today's panel, I will yield to my wonderful partner, Dr. Puckrein of the National Minority Quality Forum, for this morning's greetings. Then we'll hear from our dynamic speaker, all the way from Prague, our morning plenary, Dr. Luther Clark of Merck. Dr. Puckrein?
Good morning. I have a tremendous pleasure to introduce you to really a personal friend this morning. I've worked with Dr. Clark for a long time. Dr. Luther Clark is the Global Director of Scientific Medical and Patient Perspective in the Office of the Chief Medical Officer at Merck. In this role, he supports the Chief Medical Officer by gathering internal and external scientific and medical information to assist with decision-making at the highest level. Dr. Clark is a key member of the team that champions the Chief Medical Officer's Healthcare Equity Strategy Initiative and chairs the Health Literacy Investigator-Initiated Studies Research Committee. Prior to the appointment to his current position, he was the Global Director for Scientific Affairs for the Cardiovascular and Atherosclerosis at Merck. Dr. Clark joined Merck in 2007. Prior to joining Merck, he was the chief of the Division of Cardiovascular Medicine at SUNY Downstate Medical Center and Kings County Hospital Center, Brooklyn, New York, as well as director and principal investigator of the National Institutes of Health, supported Brooklyn Health Disparities Center. Dr. Clark earned his Bachelor's of Art degree from Harvard College and his medical degree from Harvard Medical School. He has authored more than 100 publications. He's a fellow of the American College of Cardiology, the American College of Physicians, and countless other affiliations. In October 2014, he was the recipient of the Harvard University Alumni Lifetime Achievement Award for Excellence in Medicine. And he's flown in from Prague this morning to join us. So without further ado, please welcome Dr. Luther Clark.
Thank you, Gary, and thank you, Congresswoman Kelly. As they both mentioned, I did fly in from Prague, but that won't be any excuse if I kind of screw up here, so don't, don't take that. But Prague is a beautiful, beautiful place, but you can see once I get a call from Gary and from the Congresswoman, I have to be on the plane headed back to Washington, D.C. So it is a pleasure to be with you here this morning, and I'd like to again thank Congresswoman Kelly and Dr. Gary Puckrein for inviting me to speak to you and to address an issue that I really believe is one of the foundational pillars for developing innovative medical therapies, providing high-quality medical care, as well as reducing disparities and achieving health equity. And my task is really to sort of set the stage for the rest of a very exciting day, as you've already heard from Gary and from the Congresswoman here today. So my remarks will be brief, and I'll make some comment that I hope will put in context the other issues that will be discussed throughout the morning. And the session title really says it all, and that we'd like to get beyond Tuskegee and rebuild trust as keys to overcoming barriers to clinical trial participation. And I'd like to do and address with you a few specific things. One, the importance of increasing participation of clinical trials in communities of color, the major barriers to participation, which includes that enduring legacy of the Tuskegee syphilis study, which I'll mention briefly to you, and that has become perhaps the key historic marker of discontent and mistrust of biomedical research in the African American community as well as other communities of color. I'll also comment briefly on the Henrietta Lacks story, which, as I'm sure everyone in this room knows, was recently premiered as a movie that was produced and starred in by Oprah Winfrey, and which you'll get a chance to see later today. I had the great fortune of being at the premiere last week, and if you have not already seen it, this is an absolutely amazing story about how the cervical cancer cells from a poor Black woman has been responsible for some of the most important advances in modern medicine. But also, as you heard, since these cells were taken without her knowledge and without her consent, it is also a commentary on bioethics, race, science, and medicine in the U.S. And then what I'd like to end with, and put this right at the beginning as well, is join in the call for action, particularly among trusted community voices, to increase awareness of knowledge about what clinical trials are, their value, and the importance of participation. So let me start by addressing briefly, why is it important? Why is participation in clinical trials important for people of color? Well, obviously, it's important that new medicines, new medical therapies be known to be effective and safe in the people who treat them and the individuals who will be taking them. But there are some compelling realities, one of which is that the prevalence of disease is not currently reflected in U.S. clinical trials. So African Americans comprise about 12% of the U.S. population, only 5% of clinical trial participants. Hispanics comprise about 16% of the population, but only 1% of clinical trial participants. And by the year 2050, those that are in ethnic minorities now will constitute more than 50% of the U.S. population. A second reason is that a number of the really important diseases disproportionately affect communities of color. These include type 2 diabetes, cardiovascular diseases, strokes, some of the infectious diseases, hepatitis C, AIDS, HIV, different types of cancer, colon cancer, prostate, cervical, and lung. And as a former commissioner of the FDA, Dr. Robert Califf said when he proclaimed 2016 the year of clinical trial diversity, it's important to keep in mind that clinical trials provide the critical base of evidence for evaluating whether a medical product is safe and effective before the product is approved for marketing. Now, I'm sure everyone in this audience has a medical cabinet at home. And when you open the doors and you look at the medicines, whether those medicines are ones that were over the counter or are there by prescription, the first step in all of them getting there was a clinical trial. So it's really important to know that these have been tested, that they're effective, that they're safe, and that you'd like to know that they're going to work in you. And a second consideration is that participation in clinical trials often will provide access to new therapies as well as the chance to continue the treatments for everyone. Now, there are a number of drivers for participation in clinical trials for communities of color. In addition to the ethical considerations that it's the right thing to do, there are also scientific, regulatory, and commercial drivers. As I mentioned, it's important to know that medicines and other therapies are safe and effective in those who will be using them. So you'd like for the studies that have been done to test them to be representative. At the regulatory level, both domestically here in the US and also internationally, there are increased demands for greater diversity in the clinical trials that are done. And delays in recruitment and participation cost billions to the sponsors of these clinical trials, and it really keeps them from patients who will need them or delay their being available. And then finally, from my current perspective, at a company where recruiting for clinical trials is always a challenge, communities of color in some way are really an important opportunity and one that is underutilized. So there's a great reason to pursue it. So you might ask yourself, if there are all these drivers, it's the right thing that they do, people would like to do it, why is it so difficult to achieve this? Why is it so difficult to increase diversity in clinical trial participation? And the short answer is that there are a number of really important barriers. These include mistrust, a lack of knowledge or comfort with the process of what a clinical trial is. There are logistical, financial, time burdens. So there are a number of reasons why this is not easy to do. But at the top of everyone's list, experts, the literature, the research that we've done, is a mistrust. And there are a number of things that contribute to the mistrust that exists for clinical trials. And these include, as has already been mentioned, historical experiences such as Tuskegee, not fully understanding the process or why it's valuable that you participate in it, fear, the stigma of being treated as a guinea pig, family members' opinions. Of course, family members' opinions are very important. And also the communication style, or I might say the lack thereof, of some investigators and their staffs. So to address Tuskegee very briefly, because I think we all have heard of Tuskegee, and we may not know some of the details, but since that will be a theme going through today, let me just remind you of a couple of things. This was clearly one of the dark chapters in our history, and one that should not be forgotten. And in conversations that we have, some people know what the Tuskegee syphilis study was, some have heard of it. Some have never heard the name, but they know that something was done that should not have been done. But in brief, Tuskegee was a longitudinal natural history study of syphilis, which was conducted from 1932 to 1972. It included 400 African American men with syphilis, and they were compared with 200 uninfected men. Now, by 1945, we had a very effective treatment for syphilis, which was penicillin. But these men were never treated, and they were never given a choice to quit the study once the benefits of penicillin was known to the researchers. And as a result of this being exposed, not until the 1970s, there was a National Research Act that was created, which really required that all federal funded research from that point forward involving human participants must be approved by an IRB. Now, 1997 represents a very interesting anniversary. This is the 20th anniversary of the apology which President Bill Clinton issued formally. So he issued a formal apology on behalf of the people of the U.S. for the CDC's role in the Tuskegee syphilis study. And what he said, and I'll quote, "The United States government did something that was wrong, deeply, profoundly, morally wrong. It was an outrage to our commitment to integrity and equality for all of our citizens." So that was May 16th, 1997. But there was something else that was done. As part of the apology, President Clinton created by executive order the National Center for Bioethics Research at Tuskegee University to prevent this from ever happening again. Now, turning to the story and the life of Henrietta Lacks, and again, for those of you who haven't or who will see the movie, this is an absolutely amazing and fascinating story. So Henrietta Lacks was a poor Black female tobacco farmer whose cervical cancer cells were taken without her knowledge in 1951. And during the previous 3 decades, scientists have been trying very hard to grow human cells, and every effort had failed until they got to Henrietta Lacks. And her cells did grow, and they thrived, and in fact, they became known as the HeLa cells, the first 2 letters of both her first and last name. And these cells, which continue to live today, have become one of the most important tools in modern medicine and are responsible for many major advances in healthcare, including such things as the polio vaccine development, treatment of diseases like herpes, leukemia, Parkinson's, influenza, gene mapping, et cetera. And ironically, when the polio vaccine was being developed and there was a need for mass production of HeLa cells, the first place or the first plant that was created to mass produce these cells was done so at Tuskegee University. So this was done and this was happening at the same time as the Tuskegee syphilis study was ongoing. So the book, which is a fascinating story of this woman's life, of her cells, but also science and medicine during this period of time, is also one that addresses ethics, race, medicine, and also scientific discovery. Now, the final part of this, and I'll just mention briefly, at Merck, where I am, we've been very interested in how to develop actionable solutions to overcoming barriers to clinical trial participation. And we recently completed a study with the Association of Black Cardiologists in which we got input from all of the participants in the clinical trial process, the investigators, referring physicians, coordinators, participants themselves, to really find out, what solutions resonated with them, what barriers were important to them, and how they would like to be engaged. And to make a long story short and to put that together with what we've commented on about Tuskegee, about Henrietta Lacks, there were a few things that really came out of this, which I think can help guide the discussions through today. The first is that, patients are first and foremost concerned about their own health, and that this should not be forgotten. And we should also be concerned most about the patient's own health. And one of the guiding principles is to ask ourselves at every case, and again, when you reflect on things like Tuskegee and the Henrietta Lacks story, what is in the best interest of the patients or the participants who volunteered for us? Clear communication is extremely important. It's an imperative. It needs to be direct, it needs to be open, it needs to fully explain and address all concerns. And then a final one, which I think all of us here are a part of, are trusted community voices. So in communities of color, but indeed all patients, but particularly those in communities of color, need to hear from trusted voices. Often, however, these trusted voices need to be activated. And one way of activating them is to take advantage of opportunities that present themselves. So I would suggest to you that the discussions today in terms of moving beyond Tuskegee, the viewing of the Henrietta Lacks movie is one of those opportunities that will really help to activate and really increase discussion in the community around this really important issue. So let me finish up by reminding you, and I know that this audience really does not need to be reminded of these points, but there are several things to kind of keep in mind and guide us through today. One is increasing clinical trial diversity is important, but it is challenging for clinical research, and it's often not easy. But the fact that it's not easy does not mean that it should not still be done. Participation of communities of color enhances research and benefits everyone. And I think what has happened with the HeLa cells cannot be a greater example of how valuable participation of communities and individuals of color in the research process, albeit this was without her knowledge or consent, to the advancement of science and medical care for everyone. Now, mistrust and skepticism resulting from experiences such as these do continue to endure, but we need to learn from them. And overcoming them can be started by how we communicate and what we communicate and who communicates with potential participants. Now, we speak a lot about trust and mistrust of the clinical research process. But one of the other issues and terms that I think we need to keep in mind that is related but not identical is trustworthiness. Because in the community, what we have been hearing is that, yes, it's important that trust be there and that we overcome mistrust, but trustworthiness is important. And what the community is saying, if you are more trustworthy, the sponsors, then perhaps we will trust you more. So that in addition to overcoming mistrust, sponsors need to address the issue of trustworthiness, and we all need to ask ourselves, how do we become more trustworthy? And those trusted voices in the community need to be heard from, they need to be activated, opportunities need to be taken advantage of. And in the words of a philosopher from 1905, George Santayana, those who cannot remember the past are condemned to repeat it, but there are certain things that we absolutely know should never be repeated. So thank you very much, and enjoy the rest of your day.
So I promised you that we're going to be about action. And one of the things that, as I was listening to Dr. Clark talk, is that we need to form a little network here so that we can begin to take on the challenge of recruiting patients into clinical trials. Each of you are in community, you're talking to folks, and we need to start a conversation in our community about participating in clinical trials. So for those of you who have cell phones, and I know all of you got cell phones, I'm asking you to take your cell phone out, because I'm going to do something. I was knocking myself on the head. Do I really want to do it? Yes, I want to do it. I want you to send me an email right now. I'm going to give you my email address, right? I'm waiting. Get the cell phone out. because we have to do this together. You know, I've been doing this 14 years. We can come and talk to you again for another 14 years about clinical trials, but now we got to go do it. So let's go do it. All right, so here's what I'd like you to do. I'd like you to send me an email. Just put in the subject line, clinical trial, and my email address is GPUCKREIN at N as in Nancy, M as in Mary, Q as in Quebec, F as in Frank.org. And I'm only going to talk to you about clinical trials. You're going to get information from us about clinical trials, and it's going to say, we need to help each other find patients for clinical trials. We have to do this, right? Otherwise, we're going to sit here and do this for another 14 years. And you're the trusted voices that Luther, I mean, that's what Luther was telling you. You're the trusted voices that have to go in community, and you're going to hear about Tuskegee, and you're going to hear about this, and you're going to hear about that. And we'll provide you with some information so that you can address it. And then what we're going to do is we're going to ask you to send emails out to some of your friends, because one of the things I learned from our president is that technology is power. This ain't costing us a lot of money. We're not going to spend a lot of money doing this, but we're going to build ourselves a community right now to deal with clinical trials, right? So we're going to the army of the willing, and if you don't do it, we ain't going to get it done, right? You are the army of the willing. You've been coming here 14 years, right? And now's the moment. So I promise you, we will reach out to you, and let's start this. Let's start this right now. Okay. That's what I think that's what we have to do. I'm just tired of talking. It's like talk. Okay. All right. As Congresswoman Kelly mentioned, the next panel will begin at 10 o'clock. It's Beyond Tuskegee Medical Mistrust and Moral Obligations in the Black Community, moderated by John Cabul of the U.S. Food and Drug Administration. I just want to part one other thing. I have to say this, and this is the historian in me that says this. I'm not sure why I'm saying it in this context, but anyway. I spent a lot of time, I read a lot of history. There was a whole movement in the 1840s and 50s leading up to the American Civil War. It was called the Negro Convention Movement. And it's a wonderful set of reading. If you ever get a chance, Google and read something about the Negro Convention Movement, because they came together every year, and they did it for 20 or 30 years, dealing with the abolition of slavery, and the best and the brightest in the community would come together. We're doing our own movement here, except the difference back then is they went back to community and actually got it done. They actually did it, and they worked together. So I'm about this. We'll see. I'm looking for those emails. In fact, I should look and see if I got any emails right now, right? Your email, I'm going to tell you right now. If you're emailing me, if you ain't emailing me, I'm going to know. So, I'm going to call you out if you haven't, right? I mean, that's the point of the exercise. That's the power of technology. I'm looking. I don't see nothing in here say clinical trials. I'm just telling you. All right. So I'll be back. Okay, thank you. You setting one? All right, I'm going to look for it. Thanks.